So welcome back, everyone. I'm bringing on guests who have been on with me now several times. I have with me Helen and Jennifer Walker, and they're the owners of Walker and Walker Health Advisors. I want you to tell everybody first a little bit about yourselves. And today it was interesting with what you want to talk about. I'm excited about it. So we got to get up on those mics real close. And then I want you to tell everybody a little bit about also what we want to talk about today. But first, about yourselves.
Sure. Well, good morning, everyone, or good afternoon. My name is Helen Walker, and I am one of the owners of Walker and Walker Healthcare Advisors, shared with my daughter, Jennifer. And we together, well, I've been in business just with Medicare for about 20 plus years.
Wow.
And so I want to share today a little bit about moving around. It's becoming that time of year when we're going to start scheduling places to go, people to see, vacations, hanging out with the family, whatever. And a lot of us are questioning what kind of coverage we have when we travel. And so we're going to touch briefly on that.
So I also want to talk a little about you two as a partnership that you have, because you each bring something to the plate.
Yes.
And Jennifer, what do you bring?
So I've got backgrounds not just in healthcare as far as Medicare is concerned, but also the claims piece. So claims processing, I ran a department that processed Medicaid and Medicare claims. So even this past week, I've had clients call because they got a bill and they were confused.
Mm-hmm.
And so taking that time to explain to them the process itself, if they really actually owe the bill that they received, and what the next steps are if it's something they in fact truly do not owe.
I think that's great that you have that, because I just have to say, I've had myself many times that I get a bill that I'm not sure what it's for, and I wish I had somebody that I could call and talk to. And I think it's great that you have that, so that people can, I think what people need to understand is, first of all, that people like you exist.
Yes.
Number one, that it is a free service, and that is true that it is a free service, because a lot of people think it's too good to be true, but it is not, it is true. And also for the fact that you have, one thing about when you call, let's say an 800 number, you're not going to get that same person again. There's just no way. And with you,
True.
It's like having somebody in your back pocket all the time to ask any of the questions that you have that come up.
Yes.
Very true. And one thing that really helped is people think, oh, I want to change my plan. I got to change who my person is. And one of the people that just called this past week, she called me about a bill she received from a data service a year and a half ago. Completely different plan, completely different carrier, and she didn't know what to do. But because I was her agent through both of them, I could definitely tell her, okay, this is what we need to do. These are the next steps we need to take, because I had that history with her from the previous carrier and what those benefits were. So it was nice for her.
And I also have my ex-husband who has had a question just by, I happened to be talking to you, say, hey, I want to ask you a question for him. And you went so far out of your way to not only, even when you found what you thought was the answer, even though maybe it was not right, you were looking at it even further than after we hung up, and then called me and said, hey, I want to let you know this is what we're going to do, what we can do, or what you can do. And that's awesome. To have somebody like that is just awesome. And I want people to know too that right now, you wanted to talk a little bit about, Helen, what's going on right now a little bit.
Sure. So first of all, it's the beginning of the year. I'm going to touch on two major things. It is the beginning of the year, and so I want to encourage everyone, no matter what Medicare plan you're on, just to verify your doctors are covered and your medications are covered. And sometimes you need some clarity depending on what type of plan you're on. But one of the most important things is plenty of people on Medicare are fearful of when they travel away from their immediate home site that they may be lacking in getting excellent care when traveling. So the majority of your Medicare plans always cover you in the United States for medical emergencies by going to the hospital emergency room or urgent care. You cannot run into a private doctor's office but all the time, but you always have access to the emergency room and urgent care. Never be fearful of not being able to access your care. Some of your plans even have what we call teledoc services, where you can actually, no matter where you are, you can call home and through teledoc talk to your doctor. That service is available for many of you on your plans. So before you travel, I encourage you to read through your explanation of benefits while traveling. If you're not clear on it, please do not hesitate to call the insurance carrier themselves and let them elaborate on what is available to you and what you can do. But do not be fearful that you're not going to have coverage because you're on an HMO and you can't go outside of your city or something.
Right. It's nice to know that you can be, and that safe. And telemedicine has really made a quite difference for everybody. Things changed ever since Zoom.
Yes, yes.
Out of something bad that happened with COVID and all of that, there's a lot of good that did come out of that too. As an example, let's say somebody wanted to talk to either of you. Do you do that just over the phone sometimes, or do you ever do that Zoom, or how does that work?
I've done all the above.
Yeah, that's what's so cool about it.
Yeah, especially right after COVID, when people were used to, whether it be for work or just seeing family, they still wanted to see their agent's face.
Mm-hmm.
So we could set up Zoom calls. So I've done those. I've done just straight up over the phone. And some people still like that old school touch, if you will. I want to see you in my face in my kitchen.
Mm-hmm.
No problem. Let's sit down at the table. Let's talk it through. And a lot of the good that came from that, where you had more options than just face to face, it really does help, because there's some things that the carriers have done in the past that they've kind of tweaked a little bit. So that evidence of coverage that she was talking about, that gives you more detail about all of your benefits on your plan, they've decided, you can get electronically. We won't mail it to you anymore. And so explaining to clients how you can go see where it is on an electronic basis online, or explaining you can call them and ask them to send you that hand paper copy if you really wanted, so that they know that they can still do those things that you could do before the sky was falling.
Now, the other thing that I wanted to talk about is having somebody local here and how important that is. We still have Medicare ads on television.
Yes.
I find those more than anything attract the senior population because of who they have usually on them, and they see their face and they feel like that person, is gonna call back or what have you, and it's just not like that. But calling someone local, what is your thoughts about that?
So calling somebody local, you find somebody that actually understands your coverage area. So we're here in Arizona, we know the Arizona market, we know these doctors that you're talking about, we know the specifics to the plan, versus somebody that you can call that may be in Florida or be in New York that have absolutely no idea how medical structures work. People don't realize that state by state, there's some differences.
Oh, yeah.
And so finding somebody that knows in your specific state how things work is critical and crucial, because if they don't know, and something as simple as I'm trying to find a doctor that's in my area and they don't know your area, it can be hindering.
Well, it's the worst thing ever, especially when you want a question answered and you're not getting the answers.
Yes.
And with us seniors, right?
Right, yeah, we navigate, it's a horrible navigation with the truth, much less confusion, so,
Right.
yeah.
You want to know, and you want to know now,
Yes,
right?
yes.
And when you do have somebody that can do that for you, that's what they're all about. Their phone number to call is 602-750-0620. You can check them out on their website, which is Walker and WalkerHealthCareAdvisors.com. We're going to go to a break. When we come back, I want to talk further, because there's a lot more to this there also, somebody turning 65 every day, and you help those people as well, right? So we wanna
Correct.
talk about that too. Call them direct, their phone number is 602-750-0620, and hang tight, we'll be back in just a minute.
No, to your point, I did an in-home appointment, not last week, week before. Her sister and her husband are my clients. She is 70, so been on Medicare for 5 years. And as I'm talking to her, realizing nobody ever sat down and explained just how Medicare worked. She didn't know her Medicare number. There were so many things she had no idea about. And so I literally went over there and we started at the beginning. I'm like, I know you've been on this for 5 years, but she was like, thank you. And just going through everything.
You wanna tell that story?
Sure.
Yeah, I think it would be a good idea. You work with those people, 65,
Yes.
you know, because there's a lot of people that, you know, don't know what to do,
They don't.
even with that.
Clueless, yeah.
Yeah, so is that okay that we talk a little bit about that too?
Sure, that's perfect, because there's a lot of people turning 65.
Sure,
Yeah.
sure. Yeah,
That's a great topic.
yeah. Is there anything else that you wanna get to that I make sure I do get to, or anything like that? Are we okay?
We're good.
I think we're good right there.
Okay,
That'll
good.
be a good improvement.
Okay.
Yeah,
Yeah.
that turning 65 is important.
Yeah, me too. I think that what I find that, with seniors, you know, cause I know a lot of them, that they don't care to find out. They just care that they have what they have, they're okay with it. They don't know
like change either.
what is even offered to them, and they never read that book, which you talk about, so they don't even know what their plan offers in the
Mhm.
first place, you know?
And that's the reason I brought that up, because a lot of them don't. A lot of them will be very fearful about going to see the grandkids and spending 3 weeks or a month or something, because they don't think they may get sick while they're gone.
Right,
Yeah,
right.
and that concerns them.
Right.
And they really are planning those spring break trips right now.
Yeah, they are, they are. And scared if they're gonna be covered with, well, your plan only covers you right here, that's,
It's good to know. Are you happy? Are you guys liking what we're doing here?
we are.
This is great.
Yeah, good. I'm glad.
So my friend was in town and she got to hear us.
Did she like that?
After that, she was like, oh my God, I'm driving around with celebrities. I was like, if you don't stop it. It was so funny, but she was excited for us.
Yeah.
She really was.
Yeah.
And she
I
was
love
telling
it
us
here.
how to get rid of the echo in the background too. She ran back
Smart.
in to tell, that's okay, but that was our fault, our ignorance on technology.
No, it's okay. But, okay, here we go. Is that on my list? I don't think so. Let's look at it. If it is, it's an old list. So every time that I have these people on, I usually say something, and I forgot to do it this time, and I'm gonna say it now, which is that their website is Walker & Walker Healthcare Advisors with an E. And I didn't do it, I usually always do it. And then when I saw what I wrote down compared to what it was, I knew. I'm like, oh my God, I gotta say it, because it's so easy for people to make a mistake, right?
Yes.
And that's why we wanna say. So first of all, we are talking about Medicare right now. We've been talking at the break a little bit about, one thing that I love, that you sat down and were telling me a story about somebody. Jennifer, please tell the story now real quick.
Yes, so I have a couple clients, husband and wife. Her sister reached out to me because she needed to make some changes with her plan. But as we were talking, we realized she didn't know, nobody had ever sat down and just talked about the basics, how Medicare works, what that red, white, and blue card actually does for you. So we scheduled a face-to-face meeting where I could actually go through, and we started over. She's been on Medicare for 5 years now, but nobody really explained how it worked. So we started at the beginning and explained how everything worked, and then we got into, okay, let's get the specifics now so we can get you on a different plan, but just going back so she understood how it worked. She's been just going with the flow for 5 years and not understanding how things were going.
How many people probably don't understand how Medicare works in the first place?
It's
It's a lot,
It's a
it's a
lot.
lot, it's a lot.
It's a lot, and even we found that folks that have come and met with us, they realize even things they know, there's a lot, they learn something new from the conversation that they weren't aware of.
And the first thing is today learning that you can travel, you're gonna be okay to take and make those, tell them, Helen, that you can
Yeah.
make those plans because
Yeah.
you are gonna be okay. Go
That's
ahead.
correct, yes. So many of you think because you are on a particular type of plan, specifically generally an HMO, that you don't have coverage out of your immediate service area. And that's the farthest thing from the truth when it comes to Medicare. I'm talking about Medicare. Don't confuse that with any other union plan or individual plan. But with Medicare, you can travel and always have access to a hospital emergency room or urgent care. And know if you're traveling and you forget your medications, once again, if you're not clear on how your plan works, on the back side of your healthcare card is a number to your member services or customer service. You may even have a direct line to a pharmacy. So if you run out of medications, or you dropped or you lost it, or they took it during the airport or something, know that you can arrive to wherever you are. If you don't know how it works, call your carrier, let them know you're in a specific city, area of the country, and they will help you get your medications that you need for the duration of your trip.
Now, we're gonna talk about something that happens every day. And there's a lot of people that turn 65, right?
Yes.
And you said there's a lot of them, Carol, and you can help these people. There's a lot of people who, first of all, when, I'm gonna start asking a question, when is the best time for them to call? They know that they're so excited, they're gonna be on Medicare. When do they call?
Well, that normally we generally say up to 3 months prior to the month you turn 65, okay? You usually will reach out to Social Security. Sometimes, depending on your work status, or if you're already drawing Social Security or something, they may automatically send to you your red, white, and blue Medicare card. If you're self-employed, you generally have to reach out to them and apply for your Medicare card. But generally 3 months in advance is the earliest that they generally like to start working with you.
Okay, now, when somebody is turning 65, they call you. You're gonna go over everything with them like you did with that nice lady, right?
Correct.
Because a lot of people too will try and do it on their own, okay?
Which is okay, but, and we're not discouraging that, but it can get confusing. So just because you turn 65 doesn't mean you have to start taking Medicare. We'll run through all the scenarios that you're in. You may be currently employed, plan to work for another 2 or 3, 5 years, whatever, and you're on a employer plan that is adequate to your satisfaction. Some of you are on some plans you can't wait to get off of, but we review all of those things. But as long as you have a creditable coverage, when you turn 65, you don't have to take Social Security. Medicare. You don't have to take Medicare. That only applies if you do not have any health care coverage.
Now, go ahead.
Oh, sorry,
Go
I'm
ahead.
just gonna point out, we definitely look at that with you too. Sometimes the employer plans, these days not as much, but it's still possible, it's better for you to stay on versus going on Medicare. And so we'll look at that and we'll let you know.
Oh,
And
that's
we'll
awesome.
we'll tell you, and it throws people off because they realize, well, wait a minute, you're not gonna get paid, and that's okay, that's not what we're here for. It's about educating you and making the best choice for you.
I
And
think
if the
that's
best
awesome.
choice is staying where you're at, we'll tell you that.
So their phone number is 602-750-0620. Check them out. Their website is Walker and Walker Healthcare Advisors with an E.com. And what I want people to understand is, first of all, number one, if you're turning soon, if you're 3 months out from being turning 65, having somebody help you walk through this is awesome. And it's okay, like you said, I love that you said that it's okay that you're not, if you don't make the money on it, because that's not what it's all about. It's educating you. What's right for you is the most important thing.
Correct.
And when it comes to Medicare too, people don't understand too. Number one, it costs money, right? And money is money. I don't care what it is, it's money. And the seniors, it's the most important thing that comes out of their pocket
Yes.
when it does, and they need to understand. So if it's not right to be on Medicare yet, it's okay to know that, but isn't it nice that you would have somebody to talk to and ready when you are ready to go on Medicare?
Correct.
And having that person that you've already talked to who knows you now, and you can revisit it at another time,
Correct.
right?
We do, and we make sure, whether it's in person or over the phone, not only do we have that conversation, we answer your questions, and then we always try to follow up, because we've done seminars in the past before, and so we have our Medicare one-on-one, and we will provide that PowerPoint to you as well, just in case if you have follow-up questions, you're like, I know she told me, but there was so much information. You can actually go back and reference that so you can find the answer for yourself too.
Right. And what is the number one question that you get asked from somebody who's turning 65?
They want to know how much it's going to cost them. That's the main thing.
Did I
That's the
say it
first
or
thing
what?
out of their mouth.
Yeah.
How much is this going to cost me?
Right. Because I think there's two things. Number one, I think there's a lot of people that think the card's going to come in the mail and they don't have to do anything on their own, which is what?
It's not always the case.
No.
And so we have to explain to them, to inform them how you make sure that you get that card,
Right.
and what those steps are, how to
Exactly.
go, where to go to get that information.
Yeah,
Yes.
yeah. And it's nice to have somebody who's helping you through that. And then, of course, how much it costs, right?
Yes.
And then that's a big question, and I think people think it's free.
They think it's free, or they don't understand the difference between having that Part B, that's the Medicare piece, and then a plan in addition to it. They don't recognize that it's not all one price.
They think it's all together,
Yes.
right? You got questions? These are the people to talk to. You do not want to call those 800 numbers. Please do not do that. Call someone local. I think that's the main thing. And when you hear people on this show like this, they're here for you to get to know them a little bit,
Yes.
right?
Correct.
And if you have any questions, to be able to call them. And no question, there's no stupid questions, right?
Never.
And it's
Never.
always important to get them answered. You can call them direct. Again, this is a free service to you, and yes, it is, because they do get paid by the carrier. That's how they get paid. They're here to educate you. I love what you said. It's not about whether or not we get paid. It's about what's right for you,
Yes.
and to be educated on this subject. It is a very difficult subject as well. And if you're just turning 65, I know you're all excited,
Yes.
but there is a process to go and
Yes.
get that. So you're 3 months out, please give them a call. Their phone number is 602-750-0620. You're going on a vacation, let them go and reassure you of what your needs are and what they can do so that you can feel confident about what you're doing on that. Anyone who has any questions, please call them and learn, get educated on this subject the right way. Again, that number to call is 602-750-0620. Their website is Walker and Walker Healthcare Advisors with an E.com. Again, 602-750-0620.